every practice sets their price differently. Some people charge per unit. Some people charge per anatomic area they're injecting, which then they choose a certain number of units to weaken or relax that muscle. Some practices are, you're right, per unit. Some say forehead is this much, this area is this much, this area is that much. So the price of Botox typically will vary, on each specific practice, depending on what area the practice is in, depending on the expertise of the provider who's injecting the Botox. Some people will price Botox per unit. Other practices will price Botox per anatomic region of the face that's being injected. I don't think either one is right or wrong. It's just specific to each practice. The person who is providing the injections, you're also, in a way, paying for their expertise and their knowledge of facial anatomy and what muscles they're targeting and why, rather than just simply injecting a product. Because in reality, the price range can be as cheap as $10 a unit. Could be as expensive as $23 a unit. For example, in our practice, what we do is we charge a certain rate for Botox, but with that rate comes a follow-up. We don't just inject Botox and say, kind of see you later. I always want to see you back. I want to evaluate, did the product work? Do I need to add Botox in a certain area? And when I do need to add Botox in a certain area, that's free of charge. Because a lot of practices you will actually go to and they'll inject Botox and there really isn't any follow-up. So follow-up after receiving Botox injections, typically I'll see patients 2 weeks after I inject them. It's really important to me because I have photographs before I perform the injections to see which little fine lines and wrinkles or muscles that I'm actually targeting. And then I see them back after 2 weeks just to analyze my result. Am I happy with it? Is the patient happy? Or is it an area that I feel like I injected the correct number of units, but maybe that muscle is just a little thicker, a little stronger, and needed just a touch more of product. So I'll always do that. So the factors that determine the price of Botox there's a couple. So one is how many units are being injected. Two is, what area of the face, which muscles are being targeted, the region in the country, the practice that you're going to, who is selling and performing these Botox injections. And then just the expertise of the provider to perform a true facial analysis, to perform a follow-up with the patient, see did the product work, did the product not work as much as they would have liked it to, because I think follow-up is very important for patient satisfaction. Patients need to go to trained providers and somebody who they feel comfortable with. Money is always going to matter. Sometimes you can afford one provider and you may not be able to afford another practice's provider. The ideal situation would be kind of having those two gel together for the patient, where it's a price that they feel comfortable with and a provider that they feel comfortable with. I wouldn't go with one of those two being kind of a positive and the other being a negative. Those two have to be synchronous together.